Hello, I'm David Haigh. I'm the CEO and founder of Brand Finance. You'll see somewhere in the blurb that this is our 30th anniversary year. We set up on the 1st of April 1996, which was sort of an in-joke, obviously. So I think we went to a comedy night on the first night of Brand Finance. But it's 30 years, and we have been working exclusively in the same area ever since. Our strap line at the beginning was that we bridge the gap between marketing and finance. And when we started, we bridged the gap between marketing and finance almost entirely with fast-moving consumer goods brands and fast-moving consumer companies. And one of the notable things over the last 30 years is the way that the interest in branding and the relevance of branding and the value of branding has actually gradually crept all across society. So now B2B branding, service branding, nation branding, even institutional branding like the monarchy, where they're constantly talking about the monarchy brand, it has become the currency of what everyone talks about. And so that is a kind of a background to this study, because a lot of people would go, why are academic medical centres brands? This is weird. Why have you jumped onto that one? I'll come back to that in a minute. Before I do, I'd just like to go through a few facts and figures, because I suppose my job as the intro is to give you the 50,000-foot view, the helicopter view of this whole sector. So I've picked out a few statistics, which I think are really quite stunning. The size of the global economy in 2025 was 115 trillion, and they reckon that next year it will be 125 trillion, not billion. And of that, 31 trillion, or 26%, is the USA alone. So the US is very dominant economically. China is 20 trillion, roughly, and then there are 2 or 3 major countries like Germany, Japan, and India that are all in the 4 or 5 trillions. So quite big numbers, but particularly in the States. And across the world, GDP is growing, even now, at 3%, just over 3%, according to the IMF and the World Bank. Okay. The aggregate spend on healthcare globally, so within that money that's being spent, how much is being spent on healthcare, apparently is, according to the World Health Organization, is 10 trillion. And they reckon that it will probably surge and grow to 12% over the next few years. Of that, 6 trillion is spent by public authorities, in other words, governments, and this is why healthcare has become such a hot political topic for people like the Labour government. How do you pay for the NHS? How do you pay for the improvements in treatment? It is a major political issue now. And the other 4 trillion is coming from private and philanthropic sources. Now, of that total amount, this is an amazing statistic, 43% of all healthcare in the world is spent in the States. That's 4 trillion. So even bigger than its share of the world GDP. And of that, 40% is spent on hospitals alone in America. So 1.6 trillion is being spent on hospitals in America. And that's all from the OECD. So what are the drivers of healthcare spend? Well, I used AI, actually. I just put it in. What is driving healthcare spend? So this is a proof to me that it makes it very easy to do a speech these days, assuming that they're not telling me lies. First of all, the number one, according to insurance companies, that is driving healthcare spend is tech and pharma innovation. And obviously AMCs are at the centre of that. So the rapid improvement in what we can do is one of the major reasons why healthcare is going big. Secondly, many people might think this is a real reason, is that we've got an ageing population. And so the number of, or rather 50% of all healthcare worldwide is spent on people who are over 60, which obviously is skewed towards the developed world, not the developing world. Thirdly is the rise of chronic diseases like cancer, heart disease, and diabetes. Fourthly is a shift from public to private care, because public can't really afford it anymore, so people are having to pay more privately. And then finally, things like trade, tariffs, trade restrictions, creating medical inflation. So those are all the sort of drivers that are pushing it up from 10 to 12%. And, to start coming down from the 50,000 feet, I then thought, well, so what are we spending on biomedical research? And apparently, a subset of that bigger number is what's being spent on research. But even that is 300 billion into 2025. And they reckon that by 2029, something in the order of 350 billion will be spent a year on R&D. And again, the AMCs are right at the centre of all that. The US in that area accounts for almost 50% of the total amount of R&D spent. You know, it's quite interesting to put it all in the context. We moan about America. Sometimes we moan about America. But actually, when you look at it, they are the ones that are driving most of this activity, or they have been historically. And the National Institutes of Health account for 38% of global R&D on their own. Now, this is the thing that Donald Trump has decided to slash. But, you know, he's slashing from a very high number in order to help American public finance. I'm not that familiar with American public finances, but you kind of see where if America is spending 38% of all R&D worldwide, someone like Trump might go, well, let's cut that and let other people spend it. And there is clearly a shift in where the money is being spent from America to places like China, India, and Europe. So there we go with that intro. The next point is, what is the economic impact of all of that? We know that rising healthcare costs create pressures. 85% of that 300 billion, according to one statistic, happened in the States between 20 and 22, and it created 600,000 jobs. So it's a generator of jobs, it's a generator of wealth. According to one study by Impact Global Health, 71 billion of spend on R&D in high net worth countries generated 511 billion, so a massive multiple of economic return from the amount that was invested, and created 700,000 jobs and 20,000 patents. So we can see it's like an engine of generating economic growth to fulfill this demand. Now, we specialise in the valuing of IP-rich companies and their brands. So I looked at our studies. One study we've been doing for over 20 years is looking at the value of all companies quoted on stock markets worldwide. And once a year, we add them all up. You might think it's ridiculous, but we get all the stock markets in the world, there's like 100 of them. We add all of the value of the companies in them, and we add up all their balance sheets and compare one thing with the other. And at the last count, something like 60% of all capitalized companies worldwide was made up of intangible assets. So the values quoted on the stock market are one thing, the amounts in their balance sheet, which are largely tangibles, is another. And the tangibles were only about 40%. Now, sometimes you may have seen a statistic which says that 80% is intangible. Well, where that comes from is that it's a company in America that only looks at American stock markets. And American stock markets are much more intangible. Our study looks at the whole world, so all stock markets everywhere, including in the developing world, and even that comes to 60%. But the fact is that something like 12.5 trillion in there is healthcare companies of the total amount on these stock markets, and of that, a very large proportion is in America. Now, as I've said, we value and look at the value of branded companies, but we also look at the value of the brands within them. So it's a subset of the value of those businesses. And we publish a study every year with 5,000 brands, which we do from public sources. And I got someone to add up, what is the value of healthcare-related brands in our study of 5,000? So they added it all up. And it comes to 400 billion in our study of 5,000 brands all around the world. We are talking very, very big numbers. Now, we have always said that the most valuable and strongest brands start by being really good at the fundamentals. It's sort of like a statement of the bleeding obvious, isn't it? Sometimes people talk about brands as though do a bit of advertising and you'll get a great brand. No, do the things right, do the things better, innovate, and then build the emotional connection with the brand. That is how you get really strong brands, really valuable brands. You know, something like TikTok, for example. Not that I use TikTok that much, but it seems to me that it works very well, and everyone thinks it works very well, and it's generated huge value. And there are lots of other similar brands where they've innovated and then built a brand on the back of it. AMCs as I've said a minute ago, they're really brands in themselves. But I think it's fairly recent that people have begun thinking about AMCs as brands. But, when you think about it, you go, oh, yeah, well, Johns Hopkins, Oxford, KFSH, within the orbit of people who know them, they are extremely strong brands that have a high reputation, high trust, and what more could explain a brand? That is what a brand is. People want to associate with, give business to, and so on, the brands they trust, like, and respect. And so I was just looking at some of the brands in the pharmaceutical and medical area, and many of them are really almost household names. For a long time, pharmaceutical brands have been extremely well known. Things like Zantac, very famous brand 20 years ago, Viagra, very famous brand. Wegovy is one of the more recent ones, which sort of jumped from nothing on the back of an amazing technology to being bigger than, I think the stats were that it was bigger than half the companies in the UN. Countries in the UN. The turnover of Wegovy and Novo Nordisk was higher than all the other countries in Africa put together, or something ridiculous. Because those kind of innovations combined with very good marketing result in very high value. And then in addition to that, you have things like medical device companies like ResMed, who we've worked with in Australia, Siemens, and so on. So there's a whole lively industry of brands being driven by what the AMCs do. So that is my justification for why is Brand Finance here talking about these darn things. 4 years ago, we decided we would research this properly. We have gradually been going from sector to sector, substantiating our work, our valuation work, with high quality research. And so I'm pleased to say that this is the 4th iteration of the research we've done. We interviewed 2,500 informed academic medical professionals worldwide and ask their opinion. We actually get data on the top 500 AMCs. We only publish the top 250, but we've got data on the other 250 as well. And as the months go by, we will be releasing certain analysis from that. The point being that when you get to the second 250, the samples aren't so great, so it's more indicative than bulletproof research, shall we say. But in the 250, it's pretty strong. We have quite big samples, and it gives you a good idea. Now, within that, we have something like 30 or 40 questions, all sorts of questions about why do people think a particular AMC is good or bad. And I think that is tremendous diagnostic research for any AMC marketing people to look at and think about and decide, well, why are we considered good, bad, or indifferent? And that's me. So that is how we got to where we are. And I'm now going to hand to Hugo, who's running this study, to explain in more detail what some of the results are. Thank you.
Thanks, David. That's me. A quick intro to me. I'm Hugo. I run this study. I'm one of the valuation directors in London with Brand Finance. This is the report. I think there's a QR code that was on some of the tables outside. The report is now live, and you can look at our top 100 ranking if you're looking for a particular friend or your own organisation to see where you sit. Clicker's working. And so, David gave a great intro. He doesn't normally say so many numbers, so you're going to see some numbers again. I'm the one who runs the study and sort of hold the data. But as a bit of background, why academic medical centres and why does our report say hospitals on the front? Really, we think about them in sort of the same way, but when doing this research, we needed to have it bounded somewhat. And what we saw as the gap in global understanding was those that cross borders, those that have an international reputation, and those that interact more strongly with the different areas of industry or government or regulators. And that's really the academic medical centres because of the cross-section across clinical care, medical research, and the academic side. And also, when I'm talking about this, we said ranking the world's most reputable academic medical centres. When I talk about brand or reputation, I'm really talking holistically about what that organisation stands for, its perceptions among those key stakeholders, not the logo and not the advertising that these guys are doing. As if you're based in the UK, you'll know you don't see these guys, putting adverts on TV. You don't see them communicating, but they are nevertheless very strong brands that those industry stakeholders have incredibly detailed perceptions of. So what is sort of that stakeholder set? Obviously, the first one is patients. In the UK, that is sort of first and foremost. The NHS has a very consistent branding to reassure patients, but around the world, actually, there's competition. And you might have private care or medical tourism as aspects where you're advertising differently to patients. Obviously, healthcare professionals, talent is a massive stakeholder group that you're trying to invite in, students, and then also more industrial elements, so startups, pharma and industry partners, as well as then research collaborators, government and regulators, and public health. So a large role of these academic medical centres is putting out things that have a wider community impact. So when you're seeing data on what your weight should be or what you should be eating, often that's driven by the studies in these academic medical centres. So whether you think they touch your life or not, they're at sort of a lot of different angles there. Reiterating a little bit of what David said on that big picture, since 2000, global population's up 30%, but annual spend per capita around the world on healthcare is up about 160%. So it's almost tripled in that period. That's not a terrible thing. That doesn't mean we're wasting money. A lot of that is additional spend in the developing world, but also it's innovations. But what we need to make sure is happening as sort of people working with academic medical centres is that that's improving impact. Because when you combine those figures, you end up, as David said, up near 10, 11 trillion in that global expenditure driven by those two factors. Another just visualization of that point from David, that's 84% of the around 12 trillion of those listed healthcare businesses. That 12 trillion doesn't include almost all of the value held in academic medical centres. They're mostly non-profit, they're not publicly listed, they may be government owned. And so this is only a portion of that, but this is what's on the market, and almost 10 trillion of that is intangible. And as we heard, a huge proportion of that in the United States. That's a higher investment over many, many years into developing that sort of strong foundation of commercial value. Just in case those numbers are sort of, we're saying trillion too much, that's what a trillion looks like, just so we don't sort of forget that these are absolutely ridiculous figures. So, as David said, why does brand finance have a hand in this? I don't pretend I'm innovating and delivering a new sort of AI initiative for academic medical centres, but ensuring that that number grows and has the greatest impact, we need the right academic medical centres to be partnering with industry, to be partnering with government, with regulators, attracting the best staff, creating the best teams, and for that, they need a strong reputation. So we come to our global top 250. Number one, again this year, Johns Hopkins. Number two, Oxford University, and then a bit of a change. We had Stanford and Mayo Clinic swapping in that top 5, with Mass General Brigham rounding out that 5. You can see in the top 5 we have 4 US names. A friend actually sat here suggested that something I should play during this speech was a clip from the film Step Brothers. I don't know if you know it, but it's there's a character in it played by Will Ferrell who is a complete moron. But even he sort of knows the name Johns Hopkins in this clip, which suggests it has that sort of broad cross-culture knowledge. And there's only very few names that sort of expand beyond that industry. You can ask me for the link to that YouTube clip later if you want. A bit of background on the study. It's 30 countries. These are designed to be regionally representative. We research over 500 academic medical centres, 2,500 healthcare professionals. We've been doing that for 4 years now, so we've hit our sort of 10,000 total sample, which means we've got really great data on actually all those 500 when we combine that data set, and we cover over sort of 30 different metrics and questions in that. So the scores are, the ranking is based on a sort of a final scoring from all those metrics. We create a scorecard of those, benchmark them against each other, so who is performing best in things like awareness metrics, so international familiarity, so outside of its home market. Johns Hopkins absolutely dominates alongside Mayo Clinic and Cleveland Clinic. But then other sort of awareness and communication metrics, such as the sentiment around conversation. We see different names popping up, things like Duke Health, resoundingly positive conversations when it comes up. We have behaviors, so this is really what we're trying to drive from a positive reputation. Things like, would you recommend this to a patient? A Parisian hospital coming out on top. So those that know that organization very, very strongly would recommend it. Consideration for research collaboration. We see hospitals in Tokyo. And then we look at over sort of 30 different attributes. Here's an example. So patient outcomes, obviously very important, sort of ultimately what we're trying to get to. Sick kids in Canada, so a very well-known children's hospital. Another children's hospital in patient experience, Great Ormond Street down the road. And then we have metrics around specialisms, as often these are very tertiary medicine focused. So MD Anderson Cancer Center. I actually spoke to MD Anderson yesterday, and they were saying they've trademarked that strike through on cancer, and there's academic medical centers and hospitals and charities all around the world who want to borrow and use that strike through for whether it's their cancer charity or other things. So really, like, that intuitively tells you that these names, these things carry a lot of impact in communicating to their audiences in what they can do. And then again, things like culture of medical progress and innovation. Monash Partners Health Translation Network. So they recently changed their name to Health Translation Network to really express the work they do, not just in delivering healthcare in, I think it's southwest Melbourne, but actually communicating with the research elements, with the academic elements to bring that around. So we can see academic medical centres really identifying that need to communicate that integration. Other things we ask in that questionnaire, things like what would influence you to refer someone internationally? So the top metrics that a doctor will say, they get a first, second, and third choice in these different metrics. The ones that come out on top, advancement of treatment, of course it is. They want that patient to have the best outcome. The reputation for a specialism, if you're referring internationally, it's likely to be because there's a specific type of tertiary care that you think they might only get or they exceptionally could get in some other institution. And then also good patient experience. Often if someone has the means to travel internationally, they would care about that factor. But we also asked the data what is important. And so we did a statistical analysis of if people are saying they would recommend a hospital, what metrics did they associate with that hospital? And the ones that correlate most highly with actual patient recommendation are some of the elements around teaching. Brand elements. So the top one, an organization that medical professionals are proud to have trained or worked at. That's very much, I really trust this brand. I trust the word of mouth from colleagues, friends I know who work there. They're very proud of that organization, and that influences me to say, yes, I would recommend someone go there. So from this analysis, we can see that it's not completely functional, not just around those elements, but actually there's communication that needs to be had between these organizations that influences genuine sort of referral and recommendation patterns. Another sort of topical one that we have is AI as a driver. This is one that was much higher up in the ranking last year. I think, I can't look into this exactly, but I think what happens is doctors at the moment are probably skeptical of real use cases and that there aren't organizations that are clearly differentiated in this metric. So no one who has really stood out and is getting those recommendations has also been able to forge a distinct positioning in AI. So that's not correlating with where people are genuinely recommending. And I think that, again, will probably change in the future as innovations come to delivering clinical care or developing new research, and that is communicated across the ecosystem. The metrics that we put together come into sort of those three main categories I mentioned, so patient treatment, research and teaching. And in our analysis, we see hospitals from all around the world scoring highly in those. So University Health Network topping in patient treatment, Charité in Berlin, scoring highly on research, and then some more surprising ones like Groote Schuur Hospital in Cape Town. I have a few South African friends, so I'm always trying to get that right, and they hate how I pronounce it still. But that's one where that scores very highly in teaching because it's regionally dominant. That's the most desirable place for people to go across a huge region of Africa. Everyone knows it. They're very proud of that organization. And if we look at the distribution of the top 100, we think actually from some of those numbers earlier, we don't see the US as completely kicking everyone out. North America with only 29, but if we sort of dial in on that, we can see that actually the USA has more academic medical centers represented in the top 100 than any other region combined, but some others that are doing well. The UK, that's nice to see. Germany, Australia, India, Canada, Saudi Arabia, sort of contributing widely. And what we can see is that there's a whole range of different regions there. So although we talk about sort of a global expansion, these doctors have a kind of concentric circles of knowledge and engagement with their hospitals, which allows, even in some more, I wouldn't say developing, but outside of that sort of US core center, to actually generate really positive clinical outcomes, research, and contributions to the industry. So when we look at the top, we see actually there's 5 regions that, these are sort of broad regions, people calculate them differently, but 5 regions that have a name in the top 15, sort of exemplifying that actually there is a really strong sort of contribution globally by these different names. Again, this South African hospital continues to perform very well. If you know the name, it's probably because it's where the first heart transplant was performed in 1967. And so that is a whole generation of doctors ago, but still that reputation has been maintained by one incredibly strong, world famous innovation, but no one really working in the NHS today, probably some, very, very seniors, but was really sort of around and working in the industry when that happened. And so it's amazing how that innovation, that reputation has carried through for so long. And that brings us on to another topic that brand finance is very interested in, another one that people say, why are you doing this? The branding of nations. So we have a massive report. We launched the latest version in Davos during the World Economic Forum a couple of weeks ago into soft power, so the strength of nations as brands and their ability to influence others positively, and the behaviors of government, but also the general public, through soft means. And one of those soft means is advancement in science and innovation. And so within that, we can look at the ranking of nations advanced in science and innovation, and we see things like the US, Germany, UK, France, Canada, Switzerland in that top 10 who really contribute to healthcare. But actually there's a sort of a slight surprise in China being top. Why doesn't China have more academic medical centers? Why isn't China, growing to be a similar size as the US in that distribution globally? Russia traditionally has had a very strong culture of research, medical research and innovation. And it's probably going to change with China. I think they produce the most research papers worldwide. Although I think the British Medical Journal was quoted saying they have absolutely top world-class research and also an enormous amount of not world-class research. And so I think we'll see that change, and as they integrate more with sort of global healthcare and some US rivalry elements with the US so dominant in the field, mean that perhaps they aren't as integrated and recognized. And then Russia sort of has been isolated, not just in recent years, but actually since sort of the Soviet Union in terms of its research in a competitive way, and so also isn't as integrated into the global system, and so its academic medical centers aren't scoring reputationally as strongly as others. But when we look at what influences someone to undertake these different behaviors at the bottom towards a nation, we can see education and science is the second most sort of important factor in driving people's decision to study in that country, third, to invest in that country, to work in that country, and even influential in what country are you looking to buy products from. So that innovation, that science is incredibly impactful there. And often what we see is that we've got these academic medical centres leading that international growth with a lot of these countries with one or two sort of great national leaders. So really taking that perceptions abroad. In the UK, I think it's the second one along, you can see those top two names are Oxford and Cambridge. So sort of globally known names for the universities, but really sort of spearheading that reputation for science and innovation, and obviously causing wider benefits. You know, people are more likely to visit if you're strongly associated with those aspects. And so that's something that not just is a nice surprise, but is something that I think nations should be consciously thinking about. Who are their champions and how should they be managing their reputation and being recognised for the achievements they're having, because it has such a wide implication. And then a last one, a little note on the UK, and I mentioned at the start, I'm not talking about logo when I talk about brand and reputation, but the NHS is very, very consistent, and the target for that is patients and public. So their quote, this is on their website with their brand guidelines, they want them to see the NHS as a single national unified service and expect and want the identity to be applied in a consistent and uniform way. It reassures them that they can rely on the quality of healthcare being provided wherever they access it. I think that's absolutely worthy and is the right choice for patients and public. But are we missing out by not creating a distinctive reputation and positioning? This is the logo of Great Ormond Street, which has branched out, has that global reputation, a lot because of its philanthropic arm, but really has seen a benefit from creating a distinctive, sort of unique identity that actually can expand it further beyond sitting within the NHS. So I don't have an answer, but is there a question of could the UK and the potential for innovation be driven by allowing or encouraging more distinctiveness for these top research and innovation institutions? That's all I've got. So we're on to our keynote